A very good afternoon to everyone. My name is Fahad Shahid, and we are live from Prime Health Facebook page and our social media YouTube channel, Prime. Very good afternoon to everyone as we are going towards the opening of schools, and of course, along with that, we've got so many things coming up. So here we are today with Dr. Gayatri, who's the pulmonologist at Prime Medical Center, Reefmore branch. And today with her, we have the doctor with us to talk on a very, very special topic that is going to be that are you thinking of whether you have a cold or you have an allergy, especially in the time when we are going through a pandemic. A lot of people have different thinkings or the symptoms that they get, they have different thinking in their mind that maybe it's not a cold, or whether it's a cold, or it's an allergy, or whether if it's something else. So Dr. Gayatri, thank you very much for joining us first of all today.
Yeah, thanks a lot.
Dr. Gayatri will be talking about this important specific topic, and in fact, though it's a huge topic definitely, but we will be focusing on how do you identify whether you are having a cold or whether that's an allergy, because both have different treatments, different medications, and the doctor will be the better person to answer all the questions. So initially, doctor will give us a short brief on the topic, and after that, we will be more than happy to take your questions in the comment section. We've got a few questions that have come before the session. We will be asking all those questions to the doctor. So, doctor, without wasting further time, doctor, our topic, is it cold or allergy? Means a lot of people cannot understand or may not be able to identify what is it actually. So I believe a pulmonologist is the right doctor to explain it, and that's where your role comes in. So I would really say now itself, so if you can just proceed accordingly. Thank you.
Thanks a lot for the introduction. And as it has been rightly pointed out, like in the wake of this, we have been going through this pandemic for the past 2 years. Like every time we have a dilemma whether should I go for the test or this respiratory symptoms really of COVID, or it is a flu, or it is allergy. This dilemma keeps running in our minds. So there are certain clear cut signs and symptoms which helps us to avoid unnecessary testing, to avoid unnecessary panic. So first, the thing which I want to explain to you was allergy. Allergy is the one thing which is like a hypersensitivity reaction. So not all people are allergic or hypersensitive to any of the allergens that things that we encounter. For example, the dust mites, the pollens, and the animal danders, and all these things are normally existing in the environment. They are not allergic to almost everybody. So there are certain people with the allergic profile. They will be found allergic to. I mean, they will elicit an hypersensitivity reaction to this exposure to this environmental existing allergens. Their body, their immune system identifies this allergens as something like a villain, this something like new thing which is getting into their system. It is going to be very dangerous to their respiratory system. So it starts making a hue cry. It starts pouring out with a lot of inflammatory mediators, and so the airway which has got a very good caliber, which is, for example, I can just show you a few things. Like this is how the respiratory, the bronchiole, the airways, the windpipe as we call, this is how it looks like. It has got a very good caliber. You see that it's all it's with a very good caliber, and we see that when it goes through an allergic reaction, you see that it is plugged with so much of secretions, inflammatory mediators are pouring in your airway. It is very much narrow. So as a result, so you experience coughing, sneezing, and all the cascade of allergic reactions starts one after the other. So what is that important sign which helps us to differentiate whether it is really an flu-like illness or it is allergy? Main thing is allergy, as I told you, with coughing, sneezing, all this will be there, but there won't be fever. Fever is one of the most important signs which differentiates whether you have a flu-like illness or it is a allergic reaction. And of course, if there is any body pain, that is classical of a flu-like illness. Fever, body pain, coughing, and all fever and body pain are one of the most important symptoms which helps differentiating. So this is in overview. And also that allergic reactions, as we see, it takes time to settle. So many times patient comes to us in the OPD saying that I have tried an antibiotic and I have tried any symptomatics for a week, it's not just working. They will date back their symptoms for more than 1 month time, so it will not settle over a period of time. So they will come back to us saying that this is happening in a pattern, this is happening in a frequency. So that is not happening with cold. We all will recuperate, our immunity will recuperate after a 1 week time in common cold. Common cold or the flu like illness, we most commonly recover within 1 week's time. But it's not so in the case of allergic reaction. It just takes a long course to settle. So these are the basic differentiating features between allergy and the flu-like illness.
Thank you so very much, Doctor, for giving us a brief on the initial thing. What is the difference between a cold and an allergy, Doctor? When a person comes into when a patient comes into a doctor, how do you differentiate, or I should say, how a person should, at least for how a person can confirm at home that whether it's a cold or it's an allergy?
That's what at home, especially this allergic symptoms, they won't be having fever. That is the most important sign. Which if you're having fever, of course you are having an infection. So that is a clear classical sign of a common cold or flu-like illness. But allergic reactions will not have this fever and all this body pain. All those are typical symptoms of flu. And whenever you cough or sneeze, it will be more a watery in consistency in allergic rhinitis. For example, in the other situation, which is a common cold-like illness, it starts with a watery consistency, and later on, if there is any superadded bacterial infection, that will be more thick in consistency.
Great, thank you, Doctor. Doctor, some questions that I have here, I really wanted to ask you that. Can smoking or being around smokers cause me to get the flu more easily? And can I take vitamins or herbs to prevent the flu?
The smoking, as concerns smoking in any way, whether as smoking, this particular question which you're posing is actually something about the second-hand smoking. As such, smokers can develop asthma and allergic reactions. Smokers' asthma is a separate entity. So it is going to alter the immune system altogether. So even if you are around the smokers, you are at the risk of developing respiratory tract infections. So this is going to alter your immunity. And of course, when you are having expecting around the flu season, so you can take some vitamin C, zinc, these or just additives, which helps boost your immune system.
Understood, absolutely. Doctor, can an allergy test detect asthma?
It's like we can, it's not asthma, like we can just try to find which are the panel of allergens. We can do a skin testing. First, the basic test when a person is coming to a pulmonologist, first we will try to elicit a history and obtain best person is the patient himself. They have to first introspect and tell us like what provoked this episode of allergy. So based on this as a guide with the history, we can do a panel of testing. First, we can start with the blood tests. Blood test available is the basic blood test that we do is a complete blood count. In that, we have to look for eosinophils. Eosinophils is one of the important marker for allergic reactions in the airway. So after that, we can do IG testing. That is, it is also an important biomarker which says that if the person is having IG mediated asthma or non-IG mediated asthma. So this, after doing this test, we can go for the specific testing. We can order for an intradermal test, an intradermal skin test. We can have a skin prick test where we test the patient with panel of allergens we have. We know there are common allergens existing in the environment. So we will do an allergic skin testing for that, and we will try to elicit the reaction. This is after introducing the allergen in your skin, maybe for 20 minutes, and after that we will check for the response. So a wheal and flare reaction, a reddening and an elevation in the skin wherever we have introduced that allergen. So this will be taken as sensitive. This will give an idea about you are sensitive to which kind of allergen. We can, based on that, we can recommend. If, for example, if the patient is not able to take up the skin test, some of the patients will have intense reactions in the body. They themselves will have, they cannot be taken away from steroids. Whenever you are on steroids and antihistamines, you cannot take up this intradermal skin test. So to get a best results, if you are not able to get off the allergen, then you have to go for a blood test. We will do a immunocap allergy test. There are other tests which are available, which is the respiratory allergy panel testing is available, and food allergy panel testing is also available. So this gives an idea as what is the specific component which is allergic to a particular individual.
Absolutely. So, doctor, what we look into this, following another question, is there a link between asthma and allergy?
Yes, of course. Yes, of course. It is a cascade of reaction. What starts? It's called the one airway disease. It starts in the upper airway. Say, for example, many of the patients will give a history classically, starting up with an allergic coughing. They will have cough, sneezing, itchy nose, itchy throat, itching over the hard palate, and everything. It all starts over a period of time, and day 2 or day 3, then they will start having breathing difficulties. So obviously there is a connect between asthma and allergic rhinitis and allergic reactions with the respiratory problem. It is called the one airway disease. It starts in the upper airway and ends in the lower respiratory tract. And of course, many of the patients can manifest with a lot of skin reactions in the form of trachea, hives, itching, and all this can also manifest.
Perfect, perfect. Thank you so very much, doctor. Doctor, looking into another question that I have here is that what are the common asthma triggers?
Common asthma triggers that we
Yeah.
see is the dust mite. Dust mite is the most common allergy which we encounter here, and so different area, geographical area has different types of allergic triggers. For example, UAE is concerned. Dubai, in a city like Dubai where it is buzzing with a whole lot of traffic, cars everywhere around, the vehicular exhaust. So these things can provoke. This can be a trigger in a, and also we know that there are a lot of construction works going on. So these construction works, when this is going on, they are going to emit a lot of fine dust particles. So this can also trigger your asthma. And in place where there is lot of flora activity, where there is where there can be grass and there can be pollen allergies are quite common in those areas. So the and if you are having the animals, for example, if you are buying a new pet, and if you start eliciting this new kind of reaction starting in you, you may be allergic to pets. So these are the most common allergies that we encounter in a day-to-day practice.
Perfect, got it. Doctor, I've got a question here from Ms. Anita. Do you recommend using air purifiers at home to alleviate allergy symptoms?
Air purifiers, of course, HEPA filters, air purifiers with the HEPA filters. That is a high efficiency particulate filtering filter that can be placed. For example, if you find that your allergic trigger is specifically happening somewhere in your house, many of them will experience these kind of allergic reactions only when they are stepping into the home. If there is indoor allergy is a matter of concern, of course, HEPA filters can reduce the quantity of the pollen or dust or anything that is there around the house, and it can improve the air quality better. We can use, of course.
Okay, great. Thank you so very much, doctor. Doctor, looking into another question I have, can I develop seasonal allergies as an adult if I didn't have them as a child?
Yes, of course, you can have seasonal allergies. You can have, that is how it starts. Like that is how it seasonal allergies. Of course, it starts as a seasonal allergy is nothing but the allergic rhinitis or the hay fever. It happens starts in the spring season, and in the early in the winter it can start. Of course.
Thank you, doctor. How can I keep from getting a cold or the flu? Should I get a flu shot or and what time of the year? And will a flu shot keep me from getting colds all year long?
So the flu shots, of course, will help. Especially, we recommend this flu shots a compulsory one for those who are aged more than 65 and underlying lung disease like COPD, and these patients who are at the increased risk of allergic reaction. Atopic individual and flu-like illness. For them, we always recommend a flu shot. That is most commonly, as we all have witnessed this pandemic vaccine, we have got a lot of awareness about the disease rate. So we have to do this. We have to have this flu shots, which will be new batch every year. They will be coming up with a new batch of vaccines, which will be in the month of October. For that particular year, they will develop vaccine that will be out in the month of October.
All right, so that's very understood, doctor. Doctor, looking into another question, how do I know that my child's itchy, watery eyes are due to allergies and not sore eyes?
So it's if it's itchy, and if this kind of itching and urticaria is a typical of allergic reactions, and if it is goes relentless over a period of time, if it is not responding to your routine medicines, if it is not associated with fever, it is more in favor of allergy. You have to check if there is something that is precipitating your allergic reactions. So these kind of, if there is any trigger around.
Doctor, are there ways to prevent seasonal allergies, and can my pets make seasonal allergies worse?
If at all you are known allergic say for example, there are many patients who are coming to us, that is something that triggered an episode of asthma and allergic rhinitis to us. So we will always ask a leading question to the patient whether you had bought any, you have done anything new in your house. For example, you have bought a new pet, which mean the pets, it is not always allergic. It is only for not all persons are allergic to pets. So it can be specific for a particular animal. Not all atopic individuals will be allergic to dogs or pet animals.
Right. Doctor, what changes should a person make at home to control the child's asthma symptoms?
So first thing is, we have to prevent the asthma triggers at home. The first thing is you have to clean the clutter wherever there is waste. No, just try to get rid of it, and you have to declutter. You have to remove all the clutter from your house. So they are the places where you will be harboring a lot of dusts. And regarding the bed and the linen and the cloths that every day that we are using, it has to be done at least once in a week. You have to wash it in a warm water and then put it under the sun, because the dust mites will be breeding there, so that can be a provocating factor for your asthma and allergic reactions. So that is one important thing that you have to do. And whenever you're cleaning the surface, you have to try doing a vacuum, because you should not, whenever you use a duster or something, no, so the dust particles keep suspending in the environment. So that can be there, and it can trigger an allergic reactions. So whenever you're cleaning, just use, or else you can, simple ways, you can use a damp cloth, a wet cloth, and then you can clean the surface. And vacuuming is very good. And whenever there is a kitchen, when you're using when you're in the kitchen waste and kitchen exhaust, and everything has to be used at a time. And these are simple ways by which we can prevent the asthma triggers.
Thank you, Doctor. Doctor, why are eggs bad for asthma, and should I avoid if I have asthma?
Children, of course, the egg allergy will manifest. It will manifest early in the childhood. So if you're allergic to eggs, then you can experience more symptoms, like you can develop an abdominal pain, nausea, and followed by which you can develop all the allergic skin reactions, urticaria, and breathing problem. All this thing can come one after the other. So whenever you are found that you are allergic, when you have challenged the child and you found this, there can be intense type of anaphylactic reaction, because the egg has got certain proteins which is called biotin and avidin. These proteins can trigger an allergic response. So if that is the case, then it's better to avoid. You have to avoid egg, and in that case, especially the muffins, cakes, and all this will have milk component in it. So we have to avoid it. And if you are found allergic, so obviously you have to avoid.
Sure, thank you. I've got a question here from Mr. Prasanna, and why using inhaler as advised? I'm getting cough, but if not using, I am not getting cough. Any specific reason?
See, it just, the inhaler, if it has got a component, if it's a steroid based inhaler, it just keeps your the airway under check. It is priming and keeping the airway. It is the problem with an allergic asthma is that the airway is all in a hyperactive state. It is always ready to shower and pour with lot of inflammatory mediators. So by using the inhaler, it keeps your airway under check. It will keep your airway optimum, not overreacting to the existing allergens. Probably you should be having some triggers around which you have to fix. What is that which is triggering your asthma, and why you have to have an inhaler always. First, fix the external environment, and also take care of your internal environment. So,
thank you. Thank you so much, Doctor, for answering those questions. Doctor, another question. How will I know if I have pneumonia?
Pneumonia. Pneumonia is more a severe kind of reaction, which the first thing what you will have is a fever. It's not the fever that you experience in a common cold or flu. Here, the fever will be a very high grade fever. You will have chills, rigors, and as we all know, the lung is like a balloon. It's a balloon which is inflating and deflating. In the around the lung, there is another covering which is called as the pleura. So whenever there is anything is happening to the lung, the pleura will react. So you will have a chest pain, you have a fever, which is a high grade fever with chills, with rigor, and all the symptoms, and you have breathing difficulty, which is very unusual. So this will prompt you to immediately seek a medical attention. So that has to be that's obviously different. That will be very unusual.
Thank you. Doctor, I've already asked you a question related to pets. Actually, I still want you to answer this question for the people to understand. How can I have a pet at home? Are some pets more likely to cause my asthma symptoms to flare up?
That's what if you are not all persons are allergic, some of them will be allergic only to perfumes, some of them will be allergic only to this house dust mite, some of them will be allergic to this animal, the stuffed toys, and animal dander and all that. So if you are really allergic to pet animals, just try to get them away, and sometimes I would just say just avoid. It's not against pet. If you are having that profile, it can make things worsen. So I would suggest you would avoid having them.
Oh, everyone. Okay, great, great. Thank you. Doctor, how will I know when my inhaler is getting empty? Am I using my inhaler the right way? Is it safe to use an inhaler with corticosteroid?
Yes. So this is a very frequently asked question. So inhalers, when you have been prescribed with the inhalers, obviously they will be having a dose in it. They will be having a dose counter. I can show you this. See, this inhaler, for example, has got a dose counter in it. It's green in color. It comes with a color code. So every time that you use an inhaler, so you see that the dose keeps decreasing, and there are color alerts for you. For example, if it is with a red color, which means the medicine is almost going to get over, you have to refill. So this most of the inhalers that we have are coming up with the dose counter. This is a simple way to know whether you're having medicines in it and when should I come for a refill. There are some inhalers which do not have a dose counter also. For that, there are the other simple way. This is a canister which will be having the medicine actually inside. So to know whether you're really having the medicine in it, what you have to do is you can just put it in the water. If it is a simple test, if it's floating, it's empty can, does not have medicine inside, and if it's sinking, it is loaded with medicine. This is a simple crude way of testing whether you have an adequate inhaler. I have patients who are using this inhaler for more than 1 year. Maybe they'll be using on and off. So most of the inhalers from the time of dispensing, and you can use it for more than 6 months to 1 year, not more than that. Then it will not be efficiently working for you. So this is a simple crude method to check, and most of the inhalers have a dose counter. So every time that you use, you can see that every time it will be, the dose counter will show that it will be decreasing every time that you use. So this is many of the devices have this.
Great, great. Thank you, doctor, for giving all that information. That was very much required. I'm sure the people who will be listening to the session webinar after this would be really getting a lot of benefit out of it. Doctor, before we end up the live session, I would really request you to give us a take-home message on the topic that we have covered today. Is it cold or allergy? So that people, will be benefited more about it. A short message, a short take-home message, if you can give.
Yes, don't be afraid of any respiratory symptom, especially the upper respiratory symptom. And if you really know, as the simple things that I told you, if you're able to differentiate, you can really take the appropriate action at the appropriate time without delaying. And allergy is absolutely controllable. You can lead a normal life even if you have an allergic profile.
Great. Thank you very much, doctor. So moving on towards the ending of the session. First of all, thank you everyone for asking the questions whoever have asked. Just to let you know that Dr. Gayathri is a specialist pulmonologist and she is currently practicing in Prime Medical Center, Reef Mall, and she's available for consultation. You can see the number at the bottom of the screen, 0470700999. You can book an appointment for her, or you can always go through our Prime Health Me app and you can book an appointment as per her schedule, and you can consult her. If you have any concerns, do write us on myprime@primehealth.ae. Before leaving, we would like to request you to please do give us a recommendation on our Facebook page and Google reviews. That is Prime Health. We'll be more than happy to make our quality better. As Prime always says that we serve our patients with personalized care. Personally, that is what we always want to spread out. So thank you very much, everyone, for watching. And we will be coming back to you with another live session in the next week. Till then, take care. Bye bye.
Thank you.